In our previous video, we explored how HIV progresses inside the body, from early infection to the advanced stage known as AIDS. But understanding the stages is only part of the story. Just as important is knowing how HIV shows up in real life, how it spreads, and how modern medicine can control and prevent it. Let's start with symptoms. One of the most challenging things about HIV is that many people don't realize they have it. In the early stage, symptoms often feel like a common viral illness. A person might develop fever, sore throat, rash, swollen lymph nodes, body aches, or extreme tiredness. These symptoms can last for a short time and then disappear, making it easy to mistake HIV for the flu. After this early phase, HIV can enter a long period where a person feels completely healthy. This is sometimes called the silent stage. There may be no obvious warning signs for years. A person goes to work, spends time with loved ones, and lives normally, all while the virus slowly weakens the immune system in the background. As the immune system becomes more damaged, symptoms may start appearing more often. A person might notice frequent infections, unexplained weight loss, long-lasting fever, night sweats, or constant fatigue. These are signals that the immune system is struggling to protect the body. If HIV is not treated and progresses to AIDS, the body becomes vulnerable to serious infections and certain cancers known as opportunistic infections. These are illnesses that usually do not affect people with healthy immune systems. But here's the important message. Today, with proper treatment, most people living with HIV never reach this stage. Now let's talk about how HIV spreads. HIV is transmitted through specific body fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common ways HIV spreads are through unprotected sexual contact with an infected partner, sharing needles or syringes, and from mother to child during pregnancy, birth, or breastfeeding. In many countries today, blood is carefully screened, so transmission through transfusion is extremely rare. Understanding how HIV does not spread is just as important. HIV cannot be passed through casual contact. Hugging, shaking hands, sharing food or water, using the same toilet, coughing, sneezing, or mosquito bites do not spread HIV. These facts help reduce fear and break down stigma. Now let's talk about treatment. And this is where the story of HIV has changed dramatically. HIV is treated with antiretroviral therapy, often called ART. These medications do not cure HIV, but they stop the virus from multiplying in the body. When someone takes ART consistently, the amount of virus in their blood can become so low that standard tests cannot detect it. This is called having an undetectable viral load. And here's something remarkable. When HIV is undetectable, it cannot be passed to sexual partners. This is known as UequalsU, meaning undetectable equals untransmittable. It's one of the most powerful discoveries in HIV medicine. With treatment, people living with HIV can live long, healthy lives. They can work, build families, and pursue their goals just like anyone else. The key is early diagnosis and consistent treatment. That's why testing matters so much. Many people with HIV do not know they have it, especially during the silent stage. Regular testing allows people to learn their status early, start treatment if needed, and protect their partners. HIV tests today are simple, fast, and often confidential. Prevention is another essential part of the picture. Using condoms during sexual activity significantly reduces the risk of HIV transmission. For people at higher risk, there is PrEP, pre-exposure prophylaxis. This is a daily medication that can reduce the risk of getting HIV by more than 90% when taken consistently. There is also PEP's post-exposure prophylaxis. If someone thinks they may have been exposed to HIV, PEP can be taken within 72 hours to reduce the chance of infection. It's an emergency prevention option that can make a major difference. For pregnant women living with HIV, proper medical care and treatment can reduce the risk of passing the virus to their baby to very low levels. So while HIV remains a global health challenge, we now have powerful tools to treat it, prevent it, and stop its spread. But there's another part of this story that matters deeply: stigma. For many people, the fear of judgment is worse than the virus itself. Misinformation has caused discrimination and silence. Education changes that. HIV is a medical condition, not a reflection of someone's character or worth. When we understand how HIV spreads, how it is treated, and how it can be prevented, fear is replaced with knowledge and stigma is replaced with compassion.